I will be presenting emphysema. I chose emphysema because the respiratory system has always been very interesting to me through all anatomy classes I have taken throughout my years of education. What is emphysema? Emphysema, which falls under COPD or chronic obstructive pulmonary disease, is a long-term lung condition affecting the respiratory system that causes shortness of breath and over time damages the thin walls of the air sacs in the lungs called alveoli. In healthy lungs, alveoli stretch and fill with air when you breathe in. The elastic sacs help the air leave when you breathe out. But when the alveoli are damaged with emphysema, it's hard to move air out of your lungs, which doesn't leave room for fresh, oxygen-rich air to enter your lungs, causing the shortness of breath. The pathophysiology behind emphysema is damage to the airways distal to the terminal bronchiole, including the respiratory bronchioles, alveolar sacs, alveolar ducts, and alveoli, collectively known as the exinus. This is primarily due to the imbalance between protesis and antiprotesis. The damage leads to weakened and enlarged air spaces and causes air trapping. The etiology of emphysema is chronic and significant exposure to noxious gases, with cigarette smoking being the most common cause. Between 80% to 90% of patients with COPD are identified as cigarette smokers. However, only 10% to 15% of cigarette smokers develop COPD. The rise of e-cigarettes has introduced another potential cause of emphysema because they can contain nicotine or be nicotine-free, but they often include numerous chemicals not found in traditional cigarettes. Environmental factors play a significant role as well in developing countries where biomass fuels and environmental pollutants such as sulfur dioxide and particulate matter are present. A rare hereditary condition, alpha-1 antitrypsin deficiency, can also lead to emphysema and liver abnormalities. This autosomal recessive disease accounts for only 1% to 2% of COPD cases and is a known risk factor for panacinal bibacillar emphysema, which can present early in life. Other contributing factors include passive smoking, recurrent lung infections, and allergies, with low birth weight in newborns being linked to a higher risk of developing COPD later in life. Emphysema is a pathological disease, and routine laboratory and radiographic studies are not typically indicated. The mainstay of this diagnosis is pulmonary function testing, particularly spirometry. In cases of abnormal values, a post-bronchodilator test may be performed. Symptoms are usually chronic shortness of breath and a cough which will significantly worsen over time. People may experience exertional shortness of breath, especially during physical activity such as arm work at or above shoulder level. Over time, the shortness of breath worsens, eventually occurring with simple daily activities and even at rest. Emphysema primarily affects older adults who smoke or have long-term exposure to lung irritants. It can affect anyone, but men between 50 and 70 are most likely to have it. The genetic condition, AATD, can cause emphysema to develop at a younger age in individuals of any gender and ethnicity. There is no definitive treatment for emphysema, but modifying risk factors and managing symptoms have been shown to slow disease progression and improve quality of life effectively. There are multiple medical interventions, which include using bronchodilators alone or with anti-inflammatory medications such as corticosteroids or phosphodiesterase 4 inhibitors. These treatments help reduce airway inflammation, improve airflow, and alleviate symptoms, enhancing overall lung function and quality of life. In conclusion, emphysema is a long-term lung condition affecting the respiratory system and damages the alveoli, making air hard to exit and oxygen-rich air to enter. Emphysema is mainly caused by chronic and long-term exposure to toxic gases, with cigarette smoke being the leading cause, but environmental and genetic factors can be causes as well. It mainly affects men ages 50 to 70 years old, but can affect younger ages and affects all races, ethnicities, and genders. While it isn't curable or reversible, there are medical treatments such as bronchodilators and anti-inflammatory medications to help provide a better quality of life. And these are my sources.